Thank you, everybody, for joining us for family-friendly workplace policies and other workplace legislation. Glad you're here. Today we have Clermont Ripley with us, who's the co-director of the North Carolina Justice Center's Workers' Rights Project. Clermont joined NCJC in 2007 after graduating from the University of Virginia School of Law, where she was awarded the Powell Fellowship for Legal Services. As a Powell Fellow, Clermont advocated on behalf of H-2B seafood workers along North Carolina's coast. She represented low-wage workers such as farm workers, processing workers, H-2B and J-1 workers, and restaurant employees in employment litigation, and advocates for changes to federal and state policies to improve the economic security of North Carolina's working families. So join me in welcoming Clermont. Thank you so much for being here.
Thanks y'all for being here. I'm gonna see if I can actually make this advance. Oh cool, that works. So I didn't actually prepare this presentation. Someone else who's a member of the NC Families Care Coalition did. The North Carolina Justice Center where I work is one of the co-conveners of that, along with Moms Rising. So Beth Messer-Smith, if y'all know her, did the bulk of the work here. I just made a few tweaks to make sure it was appropriate for today. But what I'm mostly going to be talking about is what we term family-friendly workplace policies. So you might ask, what are family-friendly workplace policies? What we're talking about are policies that allow people to both work and have a stable economic existence within their family. So we'll go into a couple specific proposals, but it's basically, so you're not having to choose, I like this language, you don't have to choose between the health of your family and your paycheck. So here's a couple examples: paid family and medical leave, earned paid sick days, pregnancy and lactation accommodations, and then fair scheduling and flexible work. I'm going to spend the bulk of my time talking about those top two because those are actually proposals before the General Assembly right now. And actually, spoiler alert, because I won't have time to get to it later, but pregnancy and lactation accommodations, actually we have those now. I think that they take effect at the end of June, but as part of an omnibus bill that passed in Congress at the end of last year, we finally have those protections. So we can shift our efforts towards other things at the state level. But here's the idea. Like, you shouldn't have to win the boss lottery to take care of yourself and our loved ones. I think that's helpful framing because a lot of times, especially if you're speaking to a legislator about this, they are employers, they are small business owners, and they'll say, well, I do such and such for my employees, and my employees are so happy, and, you know, of course we would do that. That's common sense. Well, great. That's awesome that they are good employers and that they are providing common sense benefits to their staff, but not everyone is. And we use this idea of the boss lottery a lot when we were talking about COVID protections too, because none of those COVID protections were required except for in the healthcare setting. Otherwise, they were just suggestions. So for a lot of people, that meant if you had a good workplace where they wanted to follow the suggestions, you stayed healthier. And if you were somewhere else where they were just concerned about, you know, profit and bottom line, or they couldn't afford to do the protections even if they wanted to, then you had a worse outcome during COVID. This is just some of the people involved in the movement in North Carolina in a recent General Assembly event. So first I'm going to talk about earned paid sick days. And if y'all want to know what you're holding, all these handouts I gave you, there's 3 fact sheets that are about specific legislative proposals right now. The Healthy Families and Workplaces / Paid Sick Days one is about paid sick days. So I'll be talking about that one right now. The fourth sheet is a table on both sides, and that's just a bunch of legislation that was introduced this session that has to do with workplaces in general. And if I have time, I'll go into some of the things on there that are outside of just this kind of family-friendly workplace stuff. But so why do we need legislation for paid sick days? Well, because in our state, roughly 38% of our workforce have 0 paid sick days. So that means, of course, if they have to miss work because they're sick, that they're not going to get paid. It also might mean if they have to miss work because they're sick, that they're going to be punished or retaliated against in some way. And for a lot of families, especially the ones who don't have access to paid sick days, are often the ones making a lower pay, right? So losing a couple days of work because you were sick can have a really big impact on the family's budget. You know, maybe it's their whole healthcare budget, maybe it's their whole grocery budget for the month. Who does have access to paid sick days? I do. You know, white, middle class, upper class women in office jobs, you know, we probably have access to paid sick days. But 1 in 5 workers don't have access to paid sick days. This is national. This isn't just North Carolina. And it's not only there's no access to paid sick days, there's also no access to earned paid sick days, which is what we're going to talk about in the North Carolina legislation. Nearly a quarter of U.S. adults have actually lost their job or been threatened with job loss because of missing work. And for Latinx workers and Black workers, those percentages go up. You'll see a lot of statistics in here about domestic violence and domestic violence survivors too, because a lot of, when we're talking about family-friendly workplace policies, that is part of the conversation. And it kind of goes, it's kind of on the cause and the effect side, because we know that a lot of domestic violence happens when there is a very stressful environment. And if you have economic instability, that is going to cause stress. So providing more stability can decrease domestic violence, but also having access to paid time off is really beneficial to people who are involved in domestic violence or who are domestic violence survivors. So just to define a couple things I'm talking about. So sick days are time off from work because you were sick, you know, to go see the doctor, to recover. Sometimes it can be expanded to include your preventive care or the needs of your family too. Kin care is explicitly saying you can use your sick days to care for your kin, for your family as well. And then safe days is when we are saying you can use your sick days to access resources and care related to domestic violence, sexual assault, or stalking. I think this stuff is pretty obvious, but when parents have access to paid sick days, there are benefits for children, for the health and safety of children. If a parent can have a paid day off to take care of a sick child, then they're more likely to take that day off to care for their sick child than have to choose something else for their child. Sick children are often left home alone or sent to school sick. Allowing parents to stay home prevents the spread of illness. Also, allowing sick workers to stay home prevents the spread of illness, obviously. And I'm sorry, this bottom one is cut off, and it's cut off on my screen too. But it's just statistics about how many people are involved in domestic violence. So, getting to this specific bill that's been introduced in North Carolina this year, the NC Healthy Families and Workplaces Act, or Paid Sick Days. It's House Bill 817. What it does is it would guarantee all North Carolina workers the right to earn paid time off. So it's not you get paid time off your first day of work. We're trying to make this palatable to North Carolina legislators. So you have to earn your paid time off, and you earn it at a rate of 1 day for every 30 hours worked. 1 hour for every 30 hours worked. And then it's capped at different amounts based on the size of the employer. And that's really just to be receptive to the kind of pushback from the business community saying, oh, well, we can't afford to give everyone paid time off, or our business would fall apart if people were out sick all the time. We need them here. So for smaller employers, there's less paid time off available. The sponsors in the House were T. Brown, Harrison Crawford, and G. Brown. The status of it is it did not cross over. So I'm going to assume, since we're at a legislative seminar, that y'all have some of that background on what things like that mean. But last week or the week before was crossover, and this bill, like all but one of the ones on that table I gave y'all, did not move. It pretty much was introduced, and it was immediately assigned to the Rules Committee, and it stayed there. I can tell you that we've been working on paid sick days. I've been at the Justice Center for almost 16 years now. It has been introduced every single session for that time, and even before that. And, we really thought it might have a chance of moving during COVID, because these arguments became so much stronger. People really need to be able to stay home to protect themselves, to protect their colleagues, to protect the community at large. And more people were talking about it, but it has still not moved in North Carolina. We do not have the right political environment for something like this to pass right now. But we're going to keep trying, and we're going to keep introducing it year after year to build that movement, to build the momentum, to make it, part of the conversation among legislators. There's also a federal act. I know we're supposed to be focusing on state policy, so I'll just let y'all know briefly. There's a federal act called the Healthy Families Act. It does some of the similar things, but it would apply across the country. So if this passes, then we could lay off the pressure in North Carolina to get something passed, and maybe that'll happen first. And it already includes things like it allows workers who are survivors of domestic violence, stalking, or sexual assault to use their paid sick time to access resources related to that. So it's that kin care idea.
Are there state or federal definitions of sick leave, or are those all defined by employers? Because I always thought that, like, the kin care aspect of sick leave, I suppose I'm naive, I thought it was like assumed within, sick leave.
Well, like in North Carolina, there's no definition because there's no
Guaranteed.
job protected, or there's no right to it.
So it's just your company policy.
Yeah.
Okay.
And a lot of company policies, to be honest, come from the same database of policies by a national HR
Right.
organization. So they're probably similar. But I know, like the changing definition of spouse, and, it used to be that a lot of places would say, you can do such and such if it's your spouse, and that expanded to include domestic partners. Then once same-sex marriage was legalized, people were more willing to just say spouse, but, those definitions are changing. This just shows some of what the status of paid sick days are across the country. The blue states have a paid sick time law. So if you worked in one of those states, you would already be guaranteed access to paid time off from work if you were sick. The green ones have a statewide paid time off law that allows time off for any reason, and that should include sick time, but it's not specifically a paid sick time law. And then all those little orange circles are local governments have adopted some sort of paid sick time law.
Is that just for the government employees, or is it?
I think it depends on the locality. In North Carolina, it would be limited to government. Actually, I'm not positive if this would be preempted. It's hard to do very expansive policies at the local level in North Carolina because of our state preemption.
Well, I'm assuming Wake County employees get paid sick leave.
I have a slide later about some of the local ordinances.
Even though there's no yellow circles in North Carolina.
Yeah, I think what we have is more, it's paid family leave. at the local level in several areas, but not paid sick leave. I am not the person who leads on this work for the Justice Center, so I could look into that for you. There's also, several years ago, Governor Cooper did an executive directive on safe days. And this was just for state employees. State employees do have paid sick days. And he clarified, you can use your paid sick days for safe time. So if it's related to domestic violence, sexual assault, stalking. Okay, so that was paid sick days. We're going to transition into talking about paid family and medical leave, but I'm just going to briefly look at the fact sheet to see if I wanted to highlight anything on here.
Which bills are made crossover? So
On that table, the only one is on the page that has paid time off towards the top, as opposed to the one with unionization towards the top. The very last one, which is H470, that's the only one that's moved on this whole table.
that's the only one that made crossover.
Yes.
848, I got that wrong. 8470.
No, you got H.
H. Okay, so this is it. Well, that's for Greensboro, Winston.
Yeah, it's small. It's a very small effort. It doesn't impact unless any of you are Greensboro city employees, it doesn't impact you either.
So it's city employees, it's not the corporations in those
Right.
cities.
Um,
So it's not really much of anything. Could that
It's
not
still
happen?
controversial,
Could
though.
Greensboro not have done that without a state rule?
Let me remind
I
myself
would
what it does.
assume Wake County and Raleigh give sick leave and.
It's about civil service protections. So it's not about paid
Okay.
sick leave.
What is civil service?
I couldn't tell you. I know that UE 150, the Union of Public Service Workers, has been working on it, and that civil service protections are something that that their members there want. I think it specifically has to do with maybe firefighters, police officers, but I don't know beyond that. Okay, so paid sick days we were just talking about. It's about 1 or 2 days off from work that are paid time for your own medical or health needs, or maybe a family member. Paid family medical leave. Are you all familiar with FMLA? So FMLA is this longer leave, right? You've got you're getting cancer treatment, or you've had a baby, or your partner's had a baby, or your parent is getting cancer treatment, or it's a longer term need. It's not I have the flu and I need a few days off. But FMLA is not paid. So it's this right to 12 weeks of job protected leave. So that's the benefit, is you can take time off for these reasons and you'll have a job when you come back, but you're not going to get paid while you're out. There's no right to that in the FMLA. So there is an effort to get paid family and medical leave. And so that's the next thing we're going to talk about. Yeah.
Is there a reason or like a common understanding for why FMLA has to be taken simultaneously with parental leave? Because I just discovered this. My wife and I just had a baby, and she's a state employee, and you get 8 weeks parental leave, and of course FMLA is 12 weeks, and their policy at the state is that they have to be taken concurrently, and so all that achieves is that you get 4 additional weeks of leave that's unpaid at the end of it, instead of, I was like, you could take 20 weeks,
Right.
like,
I think it's, if you kind of go back to that boss lottery thing, right? Like the state's a pretty good employer in North Carolina. You get things like 8 weeks of paid parental leave, but everyone else, all they're getting is 12 weeks unpaid leave.
Right.
So,
No, I'm asking is that like a common thing in private and public, and what's the what's the rationale for that? Like,
I think the rationale is we're not going to tell businesses that they have to allow someone to be out for 20 weeks and keep
Right.
their job open. Like 12 weeks is already a burden from a business perspective. So to say, no, you've got to let them stay out 12 weeks unpaid plus whatever benefits you're offering, that might lead an employer to say, well, fine, then I'm not going to offer benefits
Right.
if I have to also let them stay out 12 weeks and also keep their job open for 12 weeks. Don't make me make arguments for employers, though.
Well, I mean, it struck me as odd that they could say that, but I guess employers.
I think
can
it's
say whatever they
written
want
into
all
the
time.
FMLA that an
Yeah.
employer can require you to take your any other paid time off
Right.
at the same time.
Yeah.
In case y'all aren't aware of this, the United States is really special in its lack of allowing paid family medical leave.
It's a nice way to say
It is just us and Papua New Guinea that have 0 weeks.
Us and who?
Papua New Guinea.
Okay.
Yeah, and then there's little numbers all over this graph showing some of the other amounts of weeks. Okay, so this is family and medical leave. Family and medical leave we just talked about. It's these 12 weeks of unpaid job protected leave for very specific reasons. And there's all kinds of qualifications. Your employer has to be of a certain size. You have to have worked there for a certain amount of time. You have to give notice. You have to, say, I need this for FMLA. And then it defines family member. The FMLA does. It defines who you can use the leave to care for. And I think it has like qualifying serious illness definitions in there too. It just turned 30. It's been around for 30 years, but who was president 30 years ago? Was that Clinton? 1993?
Clinton.
Yeah. Unfortunately, Clinton didn't have it wasn't him, it was the legislature, but the foresight to make it paid leave. Who is eligible? We're not going to get into all of this right now. But it is important to know that only 56% of the workforce is actually protected by FMLA because of those requirements, because small employers are exempted, because people who are in and out of work a lot never actually gain access to the benefit because you have to have worked for a long time. And then it's for people in low wage versus non-low wage jobs. The numbers are different. Less low wage workers are covered. But the ability to take paid leave is key, right? Like, who can afford 12 weeks of unpaid leave? Not most people. The NC Families Care Coalition had some money that they used to put these billboards up across the state around before last year's election. Is that just last year? Yes. And a whole effort to engage voters about some of these policies to say, ask the people running at the local, state, and federal level about, do you support paid family medical leave? Do you support paid sick days? So this was one of the billboards in that effort. So a lot of people don't take their FMLA because they can't afford it, which means people give birth and then go back to work really quickly before their bodies have had a chance to heal, before they've been able to really establish a bond with their child maybe, or to establish breastfeeding. It further widens the pay gap and drives people into poverty. And then there's this issue about the baby boomers, this aging out of the workforce cohort. And they might require more care from their family members, and are their family members going to be able to provide it? Probably not without paid time off. Almost 1.2 million people are caregivers in North Carolina for their own family members. And 9 in 10 adults living at home with a physical, cognitive, or chronic health condition rely on unpaid family caregivers as their main source of help. So in sum, we need paid family and medical leave that's accessible to all workers, available to all workers, has a meaningful length of leave and wage replacement. It's affordable for workers, but also employers and the government, and is inclusive in defining family. Wonder what that was supposed to say. Oh, that's a video we're not going to watch. And then this is some really interesting, I think, provocative results from a study that the Duke Center for Child and Family Policy did in 2019. But their research said that if we offered 12 weeks of wage replacement, like 12 weeks of leave with some sort of wage replacement, here it's saying 80%, that would save infant lives, that it would keep 205 people out of nursing homes, which would save money for the state. It would reduce the number of individuals needing public assistance because they would not fall into poverty. And it would provide meaningful support for families addressing a loved one's opioid or other substance abuse addiction. So what the proposal that is popular is a paid family medical leave insurance program. So it's kind of like unemployment insurance or workers' comp insurance. It's something that the employer or employee would pay into so that if they need it, they have the option of a wage replacement during an extended medical leave.
Now, would that be for private insurance, or would it be for government?
It would be a government set up insurance program, but everyone would have access to it. So this little fact sheet you have is about the NC Paid Family Leave Insurance Act, which was introduced in the Senate as Senate Bill 418 by Senators Batchmeyer and Salvador. It also did not cross over.
Are those Republicans?
No.
So the probability anything will happen to it is zero.
Right. But what it does is that it establishes a paid family and medical leave insurance program. So it's a state insurance program that working people can access. And then it would provide up to 12 weeks of paid time off to care for your family member, welcome a baby, or more weeks if it's for your own serious health condition. And then it's this 26 weeks if it has to do with someone in the armed service. That's because the FMLA allows 26 weeks if it's connected to the armed service.
What's the funding model for something like this for starting out? Because I'm thinking about the history of Social Security and how it started, and of course you have payouts within the first few years, but you haven't built your base, and that's why I'll never get Social Security because it'll run out before that. But so like, what are the funding models that people who propose this say for like the base of it, or is it like something that has a ramp up period before there's disbursements?
That is a really good question. I thought there was something on here about how it works. It would probably need, I wonder if I have a copy of the bill. It would probably require like some seed money from the legislature. And maybe it's a loan, and then, the state gets paid back once the coffers have been filled with the insurance premiums. But I don't know the answer to that. I also thought, so this is mostly about why it's beneficial. It doesn't answer for us exactly how it works. Yeah, but I have some colleagues that I know did a report about how to structure it. So at the last slide has my email address on it. If you want to send me a follow-up, I can try to find that for you, because that's a really good question. And it's helpful to hear these questions so that I can say to my team members who are really working on these, like, oh, here's another question to anticipate. Okay, people are working hard to pass paid leave. Here's what I wanted to tell you about earlier. There are 24 local governments that have passed policies providing paid parental or family leave to their employees, to the government employees. So that's all they can do at the local level. They can't say all the private businesses in Hillsborough or Apex have to provide paid parental leave, but they can adopt it for themselves. So here's a couple. We've got Charlotte, Apex, Hillsborough, Morrisville, Wake County is that bottom one. I'm trying to read these signs. Chatham County, I think, is what that one says, but there's 24 so far. There's also Governor Cooper had an executive order a couple of years ago to provide paid parental leave to all state employees. And the way it's structured is there's certain parts of public employees that fall under the governor. So he can say, all of these employees who fall under me get paid leave. But then all these parts of the government he can't do that for. They had to voluntarily say, we will do this for our employees too. So the Department of Labor, for example, Cooper's executive order doesn't entitle Department of Labor employees to paid parental leave, but when Labor Commissioner Dobson took office, one of the first things he did was say, I'm expanding this executive order to all of the Department of Labor employees. So these are all the government offices that have voluntarily expanded it. There's also movement at the federal level. These are those victories I mentioned earlier with pregnancy accommodations and lactation support. And I'm going to advance to the last slide and then pick up the other. Okay, there's my email if you want it. And then I wanted to talk about two other things. The things we talked about, paid family leave and paid sick days, are very obviously connected to family well-being and family-friendly workplace policies. But we believe that increasing the minimum wage, everything that contributes to economic security is a family-friendly workplace policy as well. Strengthening the unemployment insurance system is another one of those. And there is, one of your other fact sheets is about this piece of legislation about work sharing and short-time compensation. This has not made crossover, but we are still optimistic. It has bipartisan sponsorship and it has some momentum, and let me tell you how it works. It's
Slow
right.
down a minute, let me find out which sheet is that.
Mhm. It is the one has a little Justice Center logo up here, our Scales of Justice person.
Okay, I got it, thank you, sorry.
So work sharing allows an employer to, instead of laying off people entirely if there is a slowdown, it allows them to cut back people's hours. Like say you're running a factory, demand has decreased, but laying off everyone means you're going to have to staff back up and retrain and recruit and go through all of that when the demand comes back. And that's expensive and that's time consuming. So it might be appealing to some employers to instead be able to just reduce hours, take you from 40 hours to 20 hours until the demand comes back. And what this work sharing bill would do is it would let people who've had a reduction like that from say 40 hours to 20 hours qualify for unemployment for that reduction. So they wouldn't get the same kind of unemployment insurance benefit that you would get if you lost your job entirely, but it helps you fill that gap that is created by your reduction in hours. Work sharing is, work sharing is the same thing as short-time compensation. They're just, the names are used interchangeably. So this fact sheet kind of explains how that would work and talks about some of the benefits of it, and also shows you where those programs have been adopted. The Rural Center, I know, is working hard on it, and if you want to see where it is on our table, there's a unemployment insurance section. I should have put numbers on this so we had a page 1 and 2, or an obvious front and back, but there's not. The one with unionization at the top has unemployment insurance at the bottom. And there's actually 2 different sets of bills that were introduced on work sharing and short-time compensation. They're pretty much the same. It was just a lack of coordination at the General Assembly.
Where do the labor unions stand on that?
It has been, so we have been at the Justice Center working on unemployment insurance for more than 10 years, ever since our General Assembly gutted it and turned our UI system into one of the worst in the country. And it's kind of hard to form a coalition to work on unemployment insurance. I think the labor unions are in favor of it, but most of them, through a collective bargaining agreement, already are more protected anyways. So they're less concerned about a sudden unemployment or sudden layoff because they've got a structure to protect them from that. So they're supportive, like the AFL-CIO has been a strong partner, but it's, and they're honestly one of the main partners on it, but I think it's not as much a top priority.
How many people in North Carolina, how many workers are unionized? It's not many, is it?
No, but we're not the lowest anymore. North Carolina, when I first moved here, we were the lowest. We're not anymore. My workplace is unionized. But since you asked about that, let's look at the unionization section. Our state legislature would like that number to be even lower. They have proposed to amend the North Carolina Constitution to make right to work part of the Constitution. Right to work is the misnomer, the misleading name. Right to work means, the right, like if your workplace is unionized, you don't have to join it, which sounds like, okay, it's nice, it's freedom, but the reality is that means it undermines the financial stability of the union and the union's ability to powerfully engage in bargaining. There's a lot of these are actually, most of what's on this sheet here, I describe as good legislation. Like these are all things that would be beneficial to workers in North Carolina. They would increase economic security. They would give workers more power and more protections at work. The ones that I think are harmful have a little asterisk, or they actually say bad. So that amend the Constitution to add right to work, I think is bad. So it says bad.
None of these passed crossover. Did this H614 pass crossover?
It did not. However, a very smart woman said at the beginning of this presentation that those rules don't actually apply, that none of the rules really apply to the majority. I mean, they could, if there's something on that didn't make crossover that they still want to move, then they just amend something that did make crossover and they put it in there. Or they stick it in the budget. What I heard about the constitutional amendments, though, is that the majority are still trying to figure out which constitutional amendments they want on the ballot, because they have to think strategically about, which ones are going to turn people out. If there's too many, then people might not understand them and might not vote the right way. So we only want a few. So if they decide that right to work is one of the most important ones, it'll probably move and pass. And the governor can't veto legislation to put a constitutional amendment on the ballot. But we could still vote. So just because it gets on the ballot doesn't mean bad news. But yeah, so there's a lot of really good legislation introduced. Public employees aren't allowed to engage in collective bargaining right now, so there's some legislation introduced to get rid of that ban, to let public employees exercise that bargaining right, just like private employees. So several of the unionization ones have to do with that. I guess I see another bad one I didn't flag that way. But let's look at the wages one. There's lots of efforts to increase the wage. North Carolina is still at $7.25, although a lot of the country has gone to 10 or 15 or even higher. So There's several proposals to go to 15. It's slow. Well, it's not that slow, I guess. 2025 isn't that far away. What else? On the other page.
What's another bad one that you said you didn't?
Oh, if you flip over to the other section, there's one that I don't like. It's S721, the Uniform Worker Classification Act.
And then you've got bad written there.
Oh, I see what you were asking. But let me talk about this one real quick. Have you all ever heard the phrase misclassification?
Mm-hmm.
So, like, employers decide if someone's an employee or an independent contractor all the time, but the law says something different about it. Like under wage and hour law, for example, it's very clear who's an employee versus well, it's not very clear. It's kind of confusing. But the law has an opinion about who's an employee versus an independent contractor. And this proposal would make it a lot easier for a business to legally classify someone as an independent contractor instead of an employee, which means they won't get unemployment insurance or workers' comp. They won't be protected by anti-discrimination or anti-retaliation laws. They won't be protected by minimum wage and overtime.
They'll have to pay their own taxes.
And they would have to pay their own taxes.
We'll take Social Security out.
Right, so I think that one's very bad. The other one I was referring to is S87. If you flip back again under the unionization section, the no payroll dues deduction for state employees. If you recall, back in 2017, the legislature passed a law so that employers were not allowed to do dues deduction for the farm worker union. And this is doing the same thing, but for state employees. It's just
What about teachers? Are they considered state employees?
it's a blatant way to undermine the strength of a union by making it harder for them to collect dues. Okay, I'm down to like 5 minutes. Let me pause and see what questions y'all have.
We've been interrupting you.
I know. So I can talk and fill this time if y'all don't have any questions.
So I have a question.
Yeah.
Because I just know so much about North Carolina that I have to be a realist. Is in what ways, and you mentioned one of the bills that was bipartisan, in what ways are there coalitions that cross assumed partisan lines, pronatalist or, something like where there is joint effort behind a certain bill or certain cause that your organization might care for?
Well, the first thing that comes to mind outside of the specifically workplace stuff is I have colleagues who work on reentry, like people who were formerly incarcerated, helping to reintegrate them into the economy, into society. And the coalition working on that is definitely crosses partisan lines. And part of that is because there's a lot of conservative people of faith who are interested in it from a kind of restoration standpoint. But also, I mean, the work sharing example I gave you is a bipartisan effort because it is so easy to make the case to business that this is beneficial. And you'll see when you look at these fact sheets that we lead with, why is this good for business? Why is this good for North Carolina taxpayers? And why is this good for business? Knowing that those are really the only arguments that might find traction. I mean, they're good arguments anyways, like things that are good for business are good for the state. But those are the arguments to lift up rather than just saying, it's unjust to pay people $7.25 an hour. Like, no labor is cheap labor. No labor is unskilled labor. Those arguments might appeal to me, but making the argument that if you paid people a more meaningful wage, they can participate in the economy more, that's going to bring everybody up. Those are the arguments we focus on to try to get some traction. Does that answer your question?
Yeah.
My organization works on healthcare and education and immigration, so it's not just this workplace stuff that I do. And even on immigration, we try to make the business arguments there too. There's a a bill that did make crossover, HB 10, which requires sheriffs to cooperate with ICE. And we've got, 5 or 6 sheriffs who ran on, their platform was, I'm not going to cooperate with ICE. That's not my job. That's the federal government's job. Like, immigrants are safe here. And so it's a reaction to that, right? But we've been trying to show how similar laws have impacted other states where they've passed, and the impact that has on the immigrant workforce, in order to make the case to business that you don't want to do this here. I mean, it has an impact on the lawfully present immigrants too, who are attached to perhaps immigrants who aren't lawfully present, or who are just not going to want to come to a state that is being more aggressively anti-immigrant. But I can't say that there's a good bipartisan coalition working on pro-immigrant stuff, unfortunately. Any other questions?
Do you have any hope? I mean,
Where was that victory from? Right now, most of my hope for good policies for workers passing is in the federal government and in the federal courts. I mean, I do more litigation than policy work. And, when something terrible passes, we will sue about it. We will, if there's an argument that it's unconstitutional, we'll sue about it, but we'll try to get that lawsuit in federal court, because our state courts are not a good place to be at the moment, or for the next 10 years or so. But we have to have hope, right? That's our form of resistance. Like, I'm hopeful that the veto override vote's going to be unsuccessful today. But I tend to be an optimist. Do you have any hope?
things are worse than they've ever been in my life, as far as political things are concerned. I mean, I'm a child of the 60s, so, we were doing all sorts of good stuff back then. You can't even get church people out to protest now. That's part of my hopelessness, is that good people are silent.
Mm-hmm. So on a lot of these things that haven't made crossover, like, now's not the time to call and say, hey, you need to, figure out a way to pass paid sick days. Like, I wouldn't say that's where your time should be spent right now to get these kinds of policies passed. I would focus on, Tillis and who's that other guy up there now? Bud. Maybe focus on Tillis. Tillis actually has been receptive to some paid sick days stuff. I also would say, we, like those billboards I showed you, they're part of this effort where we launched a website last year called We Work, We Vote. I think it's WeWorkWeVoteNC.org. That is full of resources for engaging people running for office, to change the conversation at city council hearings or at county commissioner meetings or at, not meetings, but at candidate forums. And we're going to be in election season again soon enough for our state representatives. So it's resources to engage them and talk about these issues and try to get people.
Unfortunately, what they say when they're running and what they vote for, and we're seeing that with the abortion issue, it's just blatantly, they change. I've got a brother that the woman that went from Democrat to Republican, she is his rep, and he's just so disgusting.
Yeah.
He said, this is just not what she ran on.
I would feel super powerless and frustrated if I lived in Charlotte and that's who represented me right now. Yeah. On the other hand, I've got representatives who I feel like I don't need to call them because they're in the minority, they agree with me on everything, but nothing that they say is actually going to matter. So, I don't know, we can show them support, we can focus on civic engagement, we can put our hope in the younger generation,
Yeah, that's where my.
And honestly, the Latinx kids who are gonna be able to vote, even though maybe some of their parents couldn't. I mean, the demographics are changing. Yeah, gotta have hope somewhere. Time's up.
In the younger kids and you younger folks.
Let me officially close, and then we can talk.
We're leaving you a pretty bad situation.
So thank you so much. That was really informative, and I know I learned quite a bit.